Politziner here with Dr. Jonathan Cutler, foot and ankle surgeon from the South Florida Foot and Ankle Centers, offices throughout Palm Beach County. Welcome, John.
Thank you very much. Great to be here.
Yeah, looking forward to this great concept that we have here. Just medical talk where we're going to be handling some of the biggest issues of the day that occur on the field, off the field, everything from the professional athlete to the high school kid all the way down to the weekend warrior. And we know you have 20 plus years of experience, Johns Hopkins training in foot and ankle, and then done thousands and thousands of surgeries yourself.
That's correct, and I'm really excited to be here. I think this is going to be truly informative for all of the people in Palm Beach County, and as we're on the podcast on 760.com, we're going to go out throughout the world.
Absolutely.
So I think this is going to be great, and we have, fortunately in Palm Beach County, we have tremendous amount of top quality surgeons from all over the country who come down here because of the population of a lot of sports medicine down here and geriatric, and they have a combination of doing both. And I know that during the course of this show, we're going to get the top people to lecture and be truly informative, not only for the lay person, which I think we're trying for, but for a lot of medical professionals who aren't up to date with the latest techniques. We're going to be able to help them out too. Yeah,
going to be something for everybody. You're right, from medical professionals to hearing from some of the biggest names that we're lucky enough that some of the biggest names in sports have gone to Palm Beach County, whether they live here, whether they train here, whether they rehab here. So we're going to be able to hear from medical professionals, and we're also going to learn if you're the average guy, if you're me, not the doctor in the white coat. If you're the average guy here, and you hear words like this guy's out for the year, this guy tore his MCL, this guy has a shoulder. What does it mean and why? And by that affects us as fans, that affects us as participants, that affects us as fantasy football owners. So all different reasons why we want to be educated, and we're going to start with that when we get back. So stay with us. It's Medical Talk on ESPN 760. ESPN 760, Steve Politziner, Dr. Jonathan Cutler from South Florida Foot and Ankle Centers. And John, we welcome in our guest today. A real privilege to have with us really one of the most highly regarded surgeons in the area and beyond. He specializes in sports medicine and orthopedic surgeon with the Orthopedic Center of Palm Beach County. It's Dr. Marc Matarazzo joining us today on Medical Talk. Thanks for being here, Doc.
Thanks for having me. It's a pleasure to be here.
Well, I'm really excited to have Dr. Matarazzo here. He's actually, I've known about him for many, many years. I've seen a lot of his work, and his patients have done phenomenal. And Dr. Matarazzo's specialty is sports medicine, where I'm looking at his resume here, and if I had to go list everything on his resume, Steve, we could be here for like a long time.
It's 5 pages, and it's all good stuff. Trained in New York, Philadelphia, performed thousands of surgeries. Is a real specialty on the knee. I think we're gonna learn a lot and get a terrific education today from Dr. Matarazzo.
Yeah, basically, I'm just looking at some of the presentations and publications. It's pages long. And what we really brought Dr. Matarazzo here today is to talk about his real specialty is the knee. The knee, Steve, is a real complex joint which has multi-ligaments, multi-bones, meniscus, all these different words that, maybe I understand a little bit, but the average person doesn't understand. And I'd like to ask Dr. Matarazzo today, tell us about the knee. Tell us why the knee is so complex. Why, what does meniscus mean? I'm not even sure what that word means. It's something about the anterior and posterior cruciate ligaments. It's a pretty complex joint, and I would wonder if you could break it down for some of our listeners into a more simple form.
Okay. The knee is primarily made up of 2 bones, the tibia, the shin bone, and the femur bone, which is the thigh bone. Predominantly, the knee flexes and bends. You straighten it or you can bend it. But there is some rotational component to it, and that plays a part in ligament injuries. Between the two, or on the ends of the bones, there's articular cartilage, which is a smooth, soft but firm tissue that lets the joints glide over one another without much friction. Between those 2 bones, there are 2 menisci, which are basically 2 C-shaped cushions that sit between the bones. those help to distribute the load and distribute the stress across the knee and take some of the impact off of the knee, and they also provide some of the secondary stabilizers. They help the ligaments in terms of keeping the knee in place.
How about, we talk about, an anterior, let's go a little bit, let's fast forward a little bit.
I think even maybe just go a little broader and say, why are so many injuries occur in and around the knee? And that's everybody from teenagers to the most trained specimens in professional sports.
Right. Well, I mean, obviously some people are born and they develop in certain ways that make them prone to injury. But most of the time, these people that are injuring themselves are putting their knee in an at-risk position, and the ligaments or the tendons or the structures that support the knee can't hold that stress, and they give or break or tear.
A lot of patients, come in to see me, and they use these words pronation, supination. I'm not sure they understand what they mean, but are those some of the reasons when someone pronates or supinates that can cause some of those injuries on a chronic basis or an acute basis?
Yeah, pronation, supination is generally talked about when you're talking about wrist movement and hand movement or foot and ankle movement. The knee is mostly flexion, extension, and rotation. There's 4 major ligaments of the knee, the ACL and the PCL. Those are the anterior and the posterior cruciate ligaments. Those are really important for the knee going forward and back, and to some degree a rotational support. The collateral ligaments, which would be the medial collateral, the lateral collateral ligaments, would provide support on a side-to-side basis. Commonly you'll injure, you'll hear an athlete has an ACL and an MCL injury. The problem with that is that you're losing, some anterior to posterior or front to back support, but then you're also losing some of the support to the side. So, the rotational stability is disrupted, and it's a much more difficult injury to treat and to come back from.
When you hear the words ACL, MCL, PCL, LCL, it sounds like though ACL is the most dreaded of them all. At least that's what we've all been led to believe. Why is that? Why is that one so much more of a difficult recovery?
Well, the ACL is probably the most commonly torn ligament that needs to be fixed. The ACL is critical for athletes that are pivoting and changing direction, stopping on a dime, changing direction, cutting. Without an ACL, it's very difficult for your knee to keep the stability and allow you to plant and cut. Really, probably the most dreaded injury would be a PCL injury with what we call the posterolateral corner, which is very difficult to rebound from, particularly to get back to sports. But fortunately, it's a much less common injury. It's usually associated with major, trauma and car crashes and such.
That's one of the things I'm interested today about is, when we hear this thing, you talk about fantasy football, and my kids are truly involved with that to a great extent, as you probably know. But when we hear about a posterior cruciate ligament on an NFL player or an NBA player, would you call that a career-ending injury for them?
Well, you talk about the posterior cruciate ligament. Surprisingly enough, a lot of athletes can play with partially PCL tears, and sometimes even isolated, complete tears of the posterior cruciate ligament. So, if you combine that with a rotational instability, a lateral collateral ligament or posterolateral corner injury, then it becomes much more, career threatening. Like I said, surprisingly enough, a partial PCL or even sometimes a complete PCL tear, much more tolerated by athletes than, say an ACL tear.
Well, it's also quite interesting, just this last weekend when the Dolphins played the Jets, we had 2 all-pro knee injuries that occurred. One was
Reggie Bush.
Mm-hmm. Which the MRI showed, I think he was okay and will be able to return.
I think it showed a contusion, so he should be fine.
Right, which is good for us Dolphin fans if we can ever pick up. And 2, for all the Jet fans that are down here, their all-pro quarterback Revis had a severe ACL injury.
Yeah, not only is that, it's obviously a devastating injury for Jets fans, as Revis's season will be over. But if you could take us into that a little bit, because you hear it's a non-contact ACL, and we're thinking these guys are the greatest athletes in the world. How is he out for the year now when nobody touched him?
Right. Well, interestingly, most ACL tears are a product of a non-contact injury. And usually what happens is the foot is planted on a surface and the knee is planting and the person is changing direction or twisting the knee, and that's when the ACL will get it'll lengthen to a degree, and then if the force continues, it will fail at that point.
And is that so in an instant where, because you're talking about players with the quick twitch muscle ability in the world, does it happen in such a millisecond that it doesn't get up to their brain to react before they can stop from being in harm's way?
Right. The vast majority of them are instantaneous. The patient will either feel a pop or they'll hear a pop, and their knee will. If you talk to them, they'll say their knee felt like it shifted out of place and came back. And what that is, it really did just shift out of place. The ligament failed and the knee shifted past where it's supposed to, and then it came back into place.
Steve Politziner, Dr. John Cutler, of course, here on Medical Talk on ESPN 760, having a fascinating conversation with Dr. Marc Matarazzo. He is the orthopedic surgeon specializing in sports medicine for the Orthopedic Center of Palm Beach County. And we're talking a little bit right now about when some professional athletes have those ACL injuries. You wonder the investments teams make into players, into trainers, into preparation, into preventative care. Is there anything that can be done, that teams, that leagues can be done? Field conditions, types of shoes and sneakers, and maybe that's probably an area too that John has a lot of expertise in. Because you're talking about millions of dollars in investments, and a case like Revis, that could be the cost of the Jets' season, could cause the difference between making the playoffs and not.
Right. There are various prevention programs that are available. Certainly equipment can help. The surfaces have been changed from the AstroTurf. That used to be a much harder, firmer surface. They've changed cleats to try to decrease that planting, that really firm planting in the ground. Linemen generally wear braces. The college, all the collegiate linemen are required to wear braces.
So that's preventative. That's not because of injuries that they suffered.
That's all preventative. Yeah, all the college linemen will have the same brace if you look closely. A lot of it has to do with mechanics, especially in young women. What we've found is that young women, when they land from a jumping position, their knees go into different angles than males, and the risk of an ACL injury in a younger female is probably 6 times greater than a comparable male. So particularly in younger women, there's a lot of prevention programs out there. Stability and strength around the knee obviously is paramount, and bracing, changes in equipment.
So they are doing some type of preventative nature.
Oh yeah,
these are.
Like you said, this is an investment. They're not just throwing these athletes out there. They're trying to take precautions, but especially at the professional level. These guys are so much faster and so much stronger, and the forces that they generate. the body just cannot take it.
So take me through, let's stay on the ACL topic for a little bit, the anterior cruciate ligament.
Sure.
That rupture occurs, what happens next?
Typically what will happen is, that the team physician will run out and they'll do a test, what's called a Lachman test. And you try to do that as quickly as possible before, all of the swelling and the pain starts. And you can generally get a little bit of a feeling as to whether the ACL has been
out there
by Dr. Lachman. And it's basically, you put the knee in a certain amount of flexion and you try to translate the knee in the direction that the ACL would prevent it to translate. And if you can get a little bit of extra translation, that would suggest that the ACL is torn. Typically, those patients those athletes won't be able to get back and play because their knee will be unstable and swollen. Generally, an MRI is ordered, and you can confirm the injury. Once you've confirmed an ACL injury, these knees are very swollen, they're stiff, they're tight. Most of the time, these athletes will undergo some preliminary physical therapy to decrease the swelling, decrease the trauma around the knee, get the soft tissue envelope to heal a little bit, regain their motion, and then at that point, they're usually deemed ready for reconstruction of the ligament.
So that would be how long would that be? From the time of the injury to the time you decide to do surgery.
Right.
How long is that going?
If you're talking about a professional athlete, they get paid to go to work to do therapy. So, they're going to be worked on 8 hours a day. And it'll probably take anywhere from, 2 to 4 weeks to prepare the knee.
And would that go same for the weekend warrior or the high school kid? We know you're involved with several high schools, Park Vista, Village Academy, St. Aloysius, in Boynton Beach. The example you just gave us about what happens when the injury occurs, is that translated down to the high school level? They do the Lachman test and then the same kind of preparation before surgery?
Yeah, typically, the sequence of events would be the same. The resources aren't necessarily there to get these kids into therapy all day every day, but we usually get them to see a therapist. They'll work with their trainers. They can work with their trainers on a more day-to-day basis, and they'll do therapy several times a week. And like I said, typically 2, 3, 4 weeks go by. We'll check them every week or so, and once their swelling is down and they have much better range of motion, then we'll get them scheduled for their reconstruction.
So Steve, just to explain to you, as Dr. Matarazzo, I'm sure, is bombarded with medical companies, orthopedic companies coming to him saying to use this all day long. Different companies are coming out with the newest, latest techniques on how to get different injuries better. Dr. Matarazzo, in your practice, what have you found that has helped heal some of these ACLs on a more rapid basis than other procedures?
Right. Well, the ACL is fascinating, and over the last couple of years, surprisingly, there have been huge strides made in ACL reconstruction, and a lot of it stems from some of the work by Dr. Freddie Fu at University of Pittsburgh, who sort of recognized that the standard way of treating the ACL was non-anatomic. In other words, most surgeons were placing the graft. When you reconstruct the ACL, you're basically replacing their ligament with a graft, which is tissue from some other source. We're actually, and I was, guilty of myself, and that's what we learned, we were placing the graft in a non-anatomic position, which means it was not replicating the original ACL. Dr. Fu and a lot of other surgeons around the world recognized that this was not anatomic, and he pioneered techniques to replicate and to put the ACL back where it belongs. Some of the other interesting things that came out of those studies were that the ACL seems to be actually a double bundle, which means there's two bundles of ligament, and for the most part we're reconstructing just one bundle. But Dr. Fu and through Smith and Nephew, who developed a lot of new equipment that allows us to better replicate that anatomic alignment of the ACL, I think we are fixing them in a much better way recently.
When we get back, we were going to talk a little bit more about will the length of these knee injuries or the rehabilitation of these knee injuries change? And you've heard words like stem cell therapy. What does all that mean? Dr. Marc Matarazzo is on the hot seat and will explain it all to us as we continue. You're listening to Medical Talk on ESPN 760.